8 questions to ask your doctor about diabetes. The importance of talking to your doctor. Having diabetes is difficult, but here's encouraging news. Aggressively managing your diabetes can make your real age up to 7.3 years younger. Whether you've just been diagnosed with diabetes or you've had it for a while, your doctor can guide you through the steps to live better with diabetes. Everything from how to manage diabetes drugs to understanding how diabetes affects the rest of your health. Start by asking your doctor these 8 questions about diabetes treatment. Should I work with a certified diabetes educator? Wondering how to read a food label, manage your frustration with diabetes, or build exercise into your day? If so, a certified diabetes educator, CDE, can help. A CDE is a healthcare professional trained to help people with diabetes improve their health and cope with the challenges. A CDE may be the single most important provider to ensure success in living well with diabetes, says Greg F. Jarity, MD, an endocrinologist in Albany, New York. Working with a diabetes educator leads to a better understanding of what diabetes is and how it can be best managed to live well and remain problem-free. The patients who do best have the right treatment tools and self-management skills. What are my numbers? Knowing your ABCs, A1C, blood pressure, and cholesterol levels, is important when you have diabetes, says Melinda Mariniuk, RD, CDE, Director of Clinical Education Programs for the Joslin Center in Boston. Understanding your goals helps you take steps to bring those numbers down. The more you know and understand about how your body works, the more motivated you are to do something to continue to improve your health, Mariniuk says. A1C, which is your average blood glucose level in the last 2 to 3 months, is especially important because it tells you how well your blood sugar is being controlled. Lowering your A1C by just 1 point can reduce your risk for complications by 40%. What should I do for exercise? Regular physical activity is critical for people with diabetes. Exercise makes body cells more sensitive to insulin, which helps lower blood glucose, Jarity says. It also lowers blood pressure, improves lipids, and burns calories, which helps with weight loss. It improves your overall sense of well-being, so it helps control stress. Ask your doctor which types of exercise are best for diabetes. Even taking 3 10-minute walks a day can help lower your blood glucose level. How can I lose weight? More than 85% of people who have type 2 diabetes are overweight or obese. Losing even a little of the extra weight can help improve insulin sensitivity. In people who have pre-diabetes, a state in which blood glucose is elevated but not high enough to be diabetes, losing just 5% to 10% of your body weight with diet and exercise helps reduce the risk of progressing to full-blown diabetes. Ask your doctor for specific weight loss programs that have helped other diabetes patients. People know intuitively what they need to do to lose weight, Mariniuk says. But they're often more successful if they have support from a program like Weight Watchers, or just having your doctor check in. How often should I check my blood sugar? Checking your blood glucose, blood sugar, is an important way to gauge how well you're managing your diabetes. How often you check typically depends on whether you're taking insulin or oral diabetes medications, says Batul Hadipoglu, MD, an endocrinologist at Cleveland Clinic. Even for people who take no medications, it's always good to know what's going on in your body, she says. Blood sugars are like light in a dark tunnel. It's information against your enemy. If you don't have information, you can't fight as well as you can. Are you going up? Are you doing well? It gives you a snapshot of how you're doing. How will I know if my blood sugar level is low? Almost everyone with diabetes experiences low blood sugar or hypoglycemia at one time or another. If your blood sugar gets too low, you're at risk of losing consciousness, which can be dangerous. The key is to recognize the symptoms of hypoglycemia and treat them before your blood glucose level drops too low. People on the brink of hypoglycemia often feel shaky, dizzy, and weak. Ask your doctor about strategies to quickly boost your blood sugar by eating carbs, a half cup of juice, for instance, or taking an injection of glucagon, a blood sugar-raising drug prescribed by your doctor. How do I avoid diabetes complications? Over time, high blood glucose levels boost the odds that you'll have diabetes complications, such as heart disease, kidney disease, and neuropathy, so it's important to ask your doctor about ways to avoid these problems. Keeping blood glucose levels down is the best insurance to guard against complications, Mellitus says. Since heart disease is the most common diabetes complication, she adds, keeping blood pressure close to your target will help protect your heart health. Also, ask your doctor about the tests and exams you need, such as kidney function tests, eye exams, and biannual dental visits. Who should be on my diabetes healthcare team? Assembling a strong team of medical experts is critical to good diabetes healthcare. Although most of your visits may be with your primary care doctor, you'll also need other specialists, such as an endocrinologist, eye doctor, podiatrist, certified diabetes educator, and dentist. It also doesn't hurt to befriend your local pharmacist, too, or seek out advice from a dietitian. Ask your doctor for referrals. Working with a team with you as the captain will allow you to create a custom plan that helps you take charge of your diabetes and live younger.